I know there's another subject, and I do believe it's linked to thyroid, and perhaps you can bring that out for us. But diabetes seems to have been a disease that's certainly exploded in terms of the numbers of people that are diagnosed with diabetes. And I know you also brought out last month, or the month before in October, a relatively close-to-home story about your own father who ultimately didn't need to use any medication for his diabetes. But could you mention a little bit about diabetes and what can be done to treat that, or why? I guess number one, why is it such a exploded diagnosis, and the routes of treatment for it?
Well, the diet of Americans and Europeans has changed over these years in which diabetes has been increasing with the greatly increased consumption of polyunsaturated vegetable oils. Even eggs now, they feed chickens so much corn and soy that even eggs have less cholesterol and more polyunsaturated fat. And in 1963 or 64, a researcher named P.J. Randle observed that he could block the oxidation of glucose just by feeding an increased amount of the fatty acids, and that's now called the Randle cycle. And that, when it became popular to feed hospitalized patients intravenously with a fat emulsion to try to keep them from losing weight, they very quickly discovered that it suppressed their immune system and caused a variety of other symptoms, but it almost immediately would cause an elevation of blood glucose, and that was exactly what P.J. Randle had noticed in his animal studies. So the diabetes was basically explained biochemically in the 1960s, when if you feed more fats, you block the response to insulin, create insulin insensitivity or resistance, and that's now called type 2 diabetes, or syndrome X.